Photoplethysmography, or PPG, is a technique that uses light to measure blood flow. It's commonly used in fitness trackers, smartwatches, and medical devices because it's a simple, non-invasive way to monitor your cardiovascular health. It works by shining a light, often from an LED, onto your skin, and this light can be in different wavelengths, like green, red, or infrared. When the light hits your skin, some of it is absorbed by the blood and the rest is reflected back. A sensor then measures how much light is reflected. So every time your heart beats, the amount of blood in the microvascular bed of your skin changes, and this affects the absorption of light from the PPG sensor. By tracking those changes, the device can monitor your heart rate, among other things which we'll get into later.
The use of PPG dates back to the early 1930s, when it was first developed as a method to study blood flow. Researchers quickly recognized that the shape of the pulse wave provided valuable information about cardiovascular health, differentiating between healthy and diseased states. But despite its early promise, PPG didn't enter clinical use until the 1980s, when it revolutionized the measurement of blood oxygen saturation in intensive care units with the advent of pulse oximeters.
Later on in the late 2000s and early 2010s, two important things happened. First, there was a growing recognition of the wealth of physiological information contained in the PPG signal beyond heart rate and oxygen saturation. And second, wearable devices equipped with PPG sensors entered the consumer market, leading to more widespread use. Today, PPG is not only used in clinical settings, but is also embedded in a wide range of consumer devices, offering the potential to transform how we monitor and manage health.
Each heartbeat pumps blood through your skin, increasing the blood volume in the microvascular bed of your skin. This change affects how much light is absorbed by the blood. When your heart beats, the blood volume increases, absorbing more light, and less light is reflected back. Between heartbeats, the blood volume decreases, absorbing less light, and more light is reflected back. The sensor captures these fluctuations in light reflection, which correspond to the pulse wave caused by your heartbeats. This data is then used to monitor your heart rate and can provide other useful physiological information.
The pulse wave signal obtained from PPG can vary depending on where the sensor is placed on the body. So for example, the signal from a fingertip might differ from that of the wrist. This variation happens because different anatomical locations have different vascular structures and skin thicknesses, which influence how light is absorbed and reflected.
At the wrist, sensors primarily measure microvascular blood flow since the major arteries are deeper beneath the skin. This location is convenient for wearables like fitness trackers and smartwatches, but can be more susceptible to motion artifacts. The fingertip has a rich blood supply close to the surface, providing a strong and clear PPG signal. This location is often used in medical devices like pulse oximeters. The earlobe or ear canal is another site with good blood flow. It again is often used in specialized medical devices.
The anatomical location of the sensor has significant implications for PPG measurements. Devices have to be designed to account for these variations so that the reading they take is accurate. So for example, proper placement is really important for obtaining a reliable signal. For wearable devices, the device needs to maintain good contact with the skin without being too tight, which could restrict blood flow, or too loose, which could cause poor signal quality. The choice of light wavelength is also important. So green light is often used in wearables for heart rate monitoring because it penetrates the skin effectively and provides a strong signal, whereas infrared light is useful for measuring deeper tissue changes and is commonly used in medical settings. And then the design and shape of the sensor must allow for consistent contact with the skin, considering the curvature and movement of different body parts. So let's say we have a PPG signal, but to turn that into something meaningful like a heart rate reading, we need to process that signal.
First, because the raw PPG signal usually contains noise from various sources like motion artifacts, we need to clean it. To get a clean signal, filters are used to eliminate unwanted frequency components. Low-pass filters remove high-frequency noise, while high-pass filters get rid of low-frequency drift. The net result of filtering is a cleaner signal that accurately reflects blood volume changes. Once we have that clean signal, next we need to detect individual heartbeats. This is typically done by identifying peaks in the signal which correspond to the systolic peaks of the pulse wave. Algorithms like the Pan-Tompkins algorithm are commonly used for this purpose, but many companies have their own proprietary algorithms too. After detecting the beats, we can then extract different features from the pulse wave. Things like the time intervals between peaks, which is used to calculate heart rate and heart rate variability, and the amplitude of the peaks, which can provide information about blood volume and vascular health, are the kinds of features that are targeted.
The challenge with all of this cleaning and processing is that lots of factors can affect the signal. Let's take breathing, for example. As you inhale and exhale, your intrathoracic pressure changes, which in turn affects venous return to the heart and the overall blood volume in the microvascular bed. These changes manifest as fluctuations in the PPG signal baseline, which results in a modulation of the PPG waveform amplitude and sometimes its frequency. The upshot is that the influence of breathing needs to be accounted for when interpreting PPG data, especially for applications like heart rate variability analysis. And then things like arrhythmias, peripheral vascular disease, and skin tone and thickness can all affect the PPG waveform. Motion artifacts too are one of the biggest challenges in obtaining a clean PPG signal. Movements like walking, running, or even slight hand motions can introduce significant noise into the PPG signal. This noise can obscure true physiological signals and lead to inaccurate readings. Advanced signal processing techniques and algorithms are then needed to filter out these artifacts and retrieve accurate data. The net result is that getting an accurate measure of a physiological signal from a PPG-derived waveform is not always a guarantee. PPG can provide a wealth of information beyond just heart rate. By analysing the PPG waveform, we can estimate other important physiological signals like respiratory rate, blood pressure, and blood oxygen saturation, and we can even detect sleep apnea and identify atrial fibrillation.
Heart rate estimation is one of the most common applications of PPG technology, and we've talked about this already. In short, each PPG signal exhibits a pulse wave for each heartbeat, which is caused by the blood volume changes in the microvascular bed. To calculate heart rate, we detect the peaks in the PPG waveform corresponding to each heartbeat. By measuring the time intervals between successive peaks, we can calculate the heart rate in beats per minute, or BPM. And because we can measure heart rate, we can also measure heart rhythm, which involves evaluating the regularity of the intervals between heartbeats. This can be used to detect things like cardiac arrhythmia or to measure your heart rate variability. Measuring, calculating, and interpreting heart rate variability is a whole separate topic, and I've already prepared a lecture on this, which I'd encourage you to have a look at. But in short, your heart is not a metronome, and the variance in the timing of successive heartbeats can give us all kinds of insights into physiological stress. When it comes to cardiac arrhythmia, studies like the Apple Heart Study and the Fitbit Heart Study have demonstrated the potential of consumer wearables to detect atrial fibrillation, one of the most common and clinically significant cardiac arrhythmias, which affects millions of people worldwide and significantly increases the risk of stroke, heart failure, and other cardiovascular complications. When a potential episode of atrial fibrillation is detected, users are often prompted to take further action, like recording an ECG or contacting their healthcare provider for a definitive diagnosis. Respiratory rate can be estimated from the PPG signal by analysing the baseline fluctuations caused by breathing. I mentioned this earlier, but as you inhale and exhale, your intrathoracic pressure changes, and this affects venous return to the heart, which in turn alters the volume of blood in the microvascular bed. These changes modulate the PPG waveform's baseline. So by extracting these low-frequency baseline variations, we can determine your respiratory rate. Advanced signal processing techniques help to isolate these fluctuations from other noise sources, and this can be used to provide us with an estimation of your breathing patterns. Blood oxygen saturation, or SpO2, is another parameter that can be estimated using PPG. Pulse oximeters typically use two wavelengths of light, red and infrared, to measure SpO2. By comparing the absorption of these two wavelengths, we can estimate the percentage of hemoglobin in the blood that is saturated with oxygen. This technique is widely used in medical devices and is increasingly being integrated into consumer health devices for continuous monitoring with good accuracy.
Estimating blood pressure using PPG is a bit more complex, but could have huge potential for remote healthcare monitoring and public health surveillance. Not too many commercially available wearables measure blood pressure using PPG, but this will likely change over the coming years as the technology improves.
One common method of measuring blood pressure from a PPG signal involves measuring the pulse transit time, or PTT, which is the time it takes for the pulse wave to travel between two arterial sites. By combining PPG data with another signal, such as an ECG, we can calculate the pulse transit time. Shorter pulse transit times generally correlate with higher blood pressure, while longer pulse transit times correlate with lower blood pressure. Algorithms are used to convert pulse transit time measurements into blood pressure estimates. Sleep apnea, especially obstructive sleep apnea, is a condition where your breathing repeatedly stops and starts during sleep. PPG can help to detect sleep apnea by monitoring blood oxygen saturation and identifying patterns of desaturation that occur during apneic events. The PPG signal can also be analysed for changes in heart rate variability and respiratory patterns during sleep.
By triangulating these different signals, wearables that track sleep can use this information to alert users to potential sleep apnea, prompting further diagnostic testing and treatment. So, photoplethysmography has a broad range of applications in both clinical and consumer health settings. And looking ahead, there are loads of exciting possibilities for further integrating and advancing PPG technology. Wearable devices in particular have huge potential, and in the coming years, the focus will be on improving sensor accuracy, reducing noise from motion artifacts, and expanding the range of measurable physiological parameters. Because wearables are becoming more and more pervasive, they will likely play a larger role in public health surveillance, remote healthcare monitoring, and physical activity incentivization on a national or even global level. But this raises a couple of important issues, including those of data access, harmonization, accuracy, and privacy. We'll talk about those in later lectures.